Sesame Street, again, has been on since, 1969, 70. And,
The
we're
man
actually going
behind
into
Elmo.
our 40th season.
Next
And,
on Black
a lot of
Nouveau.
these
Hi, I'm Milton Dockery.
And I'm Faith Collis. Welcome to Black Nouveau. On this edition, you'll meet Kevin Clash, the man who makes Elmo, and a lot of other characters you're sure to know come to life.
We'll discuss the importance of the WIC program and tell you why it's important to be counted in the 2010 census.
But first, having a safe and affordable living space is something most of us take for granted. But for individuals who are poor and mentally disabled, it can be a major challenge.
Under the leadership of the United Christian Church, the city and county of Milwaukee have joined forces to create affordable, supportive housing. Liddie Collins takes us to United House.
These are supportive housing structures created for a segment of our community that in the past was overlooked. The needs of the mentally challenged are now being focused on with buildings and services. One of those buildings is located on 25th and Center, the United House.
The purpose of United House is reaching out to the mental challenge and trying to upgrade how they live. And at United House, we don't only we deal with the whole person. We teach them about hygiene. We teach them how to take care of the house where they live. They teach them how to cook and about their diets, and to build the person up and make them feel like they're important. Sometimes when people have been left out, just like an abandoned house, when you abandon people, they feel like they're nobody. But once you let them know they're just important as anybody else, then they come up to standard. When people see that other people care and feel like they are somebody, you'll be surprised how they can move up.
This building does have good security.
How has your life improved since moving to United House?
I think what the most beneficial thing I think about United House is the way I can budget myself while I'm here. My rent's a small payment, and it's the only other bill I have besides my rent is my telephone. But they provide the electricity, and they provide the water. So this actually it's just my rent, and my telephone is all the two bills I have on the first of the month. And if I budget myself correctly, I go a long way with my dollar. I can stretch it. It does me a lot of good to be here.
What do you like most about being here?
I think what it really is the tenants, the other tenants, that we're like a family here. A lot of them I've known from years and years and years. And a lot of them go back many years into my past. So I've been around people that are mentally challenged almost all my life. So it's like I'm not in a strange land or nothing like that. So I know what it entails to be around someone like that and to know that I'm not going to be that way. I can relate to a person that's like that because I'm basically mentally challenged myself.
Residents like Ronald Love benefit from services provided by Milwaukee County. James Hill, former Director of Housing with Milwaukee County and now with the Milwaukee Center for Independent Living, said the United House is the first supportive housing development in Milwaukee County's history. It combines housing with access to support services.
Typically run the gamut from fairly intensive services like clinical case management to some degree, all the way up to services that are fairly minimal but that a resident may require just to sort of get around, like for example connecting them with local transportation services. In this particular case, services that are provided are provided by peer support specialists who are individuals, very highly trained individuals who themselves have had mental illness, but who are capable of living independently and then provide that experience as a teaching, basically to teach other residents who have not had that experience on how to function independently. Many of the individuals who live in supportive housing have not had that opportunity. In order for it to be successful, and this is what makes supportive housing so successful, the access to those kinds of services where individuals who live here can learn activities of daily living, how to budget, how to manage a household, how to interview for a job if that's a possibility. Those kinds of support services are critical to enabling individuals to succeed and live independently in the community, and that is the goal.
The United House project started with Reverend Eloy Jones and his church family trying to get homes for people, thus the start of an idea to build something small.
We wasn't thinking about a project this big because we didn't have this big of money, you understand? So we was thinking about building apartments right behind the church. But then after we checked into it and we found out that we could get funding from HUD and different people were willing, the city was willing to help, county was willing to help. So we all worked together and here we have this place. That's how this place really was built. This house was built by faith.
Building United House helped clear the area of abandoned homes, giving a facelift to the neighborhood. And the residents, Reverend Jones said, felt they had made it to the best hotel in the world.
Certain things we just don't allow here. You know, it's under the church, and we have certain rules and things that we go by. They work hard to try to help keep the place up. When people find a good place to live, you find that they'll work hard to try to help you. You know, sometimes we water the grass or what are we doing, they want to help because it's been great beneficial to them and it helped them so much.
Resident Ernest Robinson moved from the south side to United House to be closer to his family.
I'm meeting new friends and I'm starting to mix with more people. And I go to short age behavior class in Brown Deer, and I'm stopping and drinking and smoking. So my new friends don't do it either. So that's good friends.
What do you like best about living here at the United House?
They have church here on Sunday morning, and I come meet down. I like that the best when they have prayer.
Reverend Jones and the United Christian Church is still on a mission to make it better for the entire community.
A lot of times when people come from low income, and sometimes if people have lived a certain kind of way, they have to be taught how to live in a certain environment. So what we do is with the low income, we have a program where we sit down and teach them how to operate the new modern stuff that's in these new houses, how to take care of the homes, how to take care of the, we work on that. Because a lot of times it's not that the people don't want to do, but some people live so low until they don't know how to operate with certain things. So, we have that kind of program at our church where we help people to see how to do better.
Every 10 years, the federal government conducts a census. The next one is scheduled for 2010. The results help determine political boundaries and how much federal aid goes to those jurisdictions. Joining me is Sharon Robinson, Director of the city's Department of Administration and head of Milwaukee Complete Count Committee. Ms. Robinson, welcome to Black Nouveau.
Thanks for inviting me.
Sharon, explain how being counted in the census helps the city and state politically and financially.
Well, the census is the basis for determining the allocation of billions and billions of dollars of government resources. And let me give you some examples of what I mean. Take, for example, programs like Head Start, WIC, Meals on Wheels, Medicaid. All of those programs are financed based on allocations that are determined by census data.
What about politically?
Politically, it's about your voice in government. The census is also the basis for determining how many seats we'll have in the Wisconsin State Legislature as well as the United States Congress.
Okay. Any specific programs you wish to mention, Sharon?
Well, I'd like to talk about some of the city government administered programs. In my capacity as administration director, we're responsible for administering about $15 million in community federal block grant dollars. And the city also receives another portion of money, Workforce Investment Act dollars for job training, and that amounts to about $8 million. So those dollars that we receive directly benefit many community-based organizations in Milwaukee. Community organizations like the Career Youth Development Center, Social Development Commission, as well as Boys and Girls Club, the YMC, and the YWCA. And that's just a real short list. I could go on and on.
So in essence, being counted really helps not only the city and the state financially, but communities as well.
Exactly, and let me just paint one more picture of the how important this is in terms of a state program called Shared Revenue.
Okay.
The city actually receives about $200 million annually, and the state allocates that money based on data including population estimates. So we actually administer a $1 billion budget, the city of Milwaukee. So shared revenue constitutes about a quarter of that budget, and the primary programs that we allocate those dollars to are putting cops on the street and paying for firefighters, so that's critical.
Sharon, also traditionally minorities and people of color have been undercounted. Why is it important for those groups to be counted?
I mean, it's critical. When you think of the programs that I just mentioned, many of the beneficiaries of some of the low-income programs that are decided, you know, the allocations that are decided based on census figures, you know, again, they benefit those people. So if they're not counted, we're shortchanging ourselves. We're shortchanging the community and individuals in low-income
Sharon, any steps being taken to make sure that these communities are counted?
Yes, and the Mayor Tom Barrett and Common Council President Willie Hines have formed a Complete Count Committee, again, which I'm chairing. So a part of our strategy is to increase awareness in neighborhoods, especially those areas where it's hard to enumerate. You know, and we know that some of our efforts have to go toward low-income households, areas where there's a distrust of government. So take households where maybe there's been people who have been in trouble with law. We really got to send the message to those people that the census is safe, it's private, no one can use your data for anything except ensuring an accurate count.
Will there be temporary jobs as a result of the census?
Yes, there will be, and I anticipate a wave of jobs that will actually be announced by the Census Regional Office in the next 2 to 3 weeks. And so residents should really pay close attention to the media, because I know that the regional office is working on media buys to announce what residents need to do to benefit from those jobs and get registered in their bank. And they're primarily part-time enumerator jobs, so those jobs are where residents will go and help make sure residents are actually filling out the questionnaires and returning them on time.
One of the central themes I hear in your message, and you mentioned it earlier, is trust. Now, in terms of building that trust, is it safe to assume that some of those jobs will go to people who are knowledgeable about those communities?
That's
correct. And we have a limited amount of time, Sharon. Also, what type of people would you be looking for, and I guess this is a follow-up to my comment, to fill those jobs?
The kind of people we really want to get in those jobs are people in the community that the neighbors trust. And again, we're really concentrating on hard to count areas, and that's going to be critical to the strategy, hiring people that look like the people in the neighborhood.
So once again, there are a couple of themes that are coming out here. There are economic benefits to being counted. Not only that, they can benefit the community as well. Sharing a couple of more things in a limited amount of time. If people want more information, who should they call?
Actually, you can contact me personally, and I can be reached at city government at 414-286-3647. And I also encourage people to visit the website regularly. We've set up a census website, www.milwaukee.gov.
Sharon, in about 10 seconds, give us a timetable for what to expect.
What you can expect is an aggressive census awareness campaign beginning in early 2010, and your census questionnaires will be coming in March, and the deadline for returning them is April 1st, 2010, Census Day.
Sharon, thank you so much for joining us on Black Nouveau.
Thank you.
Just riding a tricycle, feeling so free.
You probably know him best as Elmo, but he's also been a number of Sesame Street characters.
It's truly cool. But you know what? I take a look at all of us,
and Baby Sinclair in Dinosaurs.
Oh, God. Oh, God.
Whoa, I'm on the floor. Whoa-oh, lots of feet. Can't get up.
Oh, it's adorable.
But his real name is Kevin Clash. He's a native of Turner Station near Baltimore, Maryland, and he started making puppets 30 years ago at the age of 10.
Sunday Film Festival with Kukla, Fran, and Ollie used to come on, and I used to love watching that show. And then, of course, Sesame Street came on. I think I was 10 at the time when it premiered. And that's the two shows where I got fascinated with puppets.
His parents played an important role in cultivating his interest in puppetry.
My parents were very, very supportive. They not only supportive of me, but my brothers and sisters also. My dad helped me build the puppet stage, and he, of course, drove me, because I wasn't driving at the time. I was too young, to the shows that I would do. And my mom helped me. She actually taught me how to sew on a Singer sewing machine, and helped me, go out and get the fabrics that I needed for the puppet. So it was a family affair, definitely.
Kevin got work in the Baltimore, D.C. region, and then with Sesame Street under the mentorship of Jim Henson. He became a staff member in 1984. He enjoys working with the celebrities who make guest appearances on the award-winning show.
It's time to say goodnight.
You don't have to worry, Elmo makes a promise, Elmo be okay.
Sesame Street, again, has been on since 1969, 70, and we're actually going into our 40th season. And a lot of these celebrities either grew up watching the show, or they have kids of their own now, and they want to, they revisit it now. And it's really nice, a really nice connection that you have, because the show's been on so long, that when they come in, they already know what the show is. They already love whatever character they love. And so there's already this connection, so it's not that hard. And you really get to know them personally, because it's not like they're, the things that they do regularly, which can be, challenging as far as the different contracts and who gets top billing and stuff like that. So it's very different coming into Sesame Street, because it's more on a personal connection. So you get to know them personally, and I've become, close friends with some of them, like Whoopi Goldberg and Rosie O'Donnell and people like that. So it's really fun. It really is a nice change for them also. All of the characters that I do are so different for different things. So I enjoy performing those characters for different reasons. So there's never really one that really stands out more than the other. Of course, Elmo is the most popular, so I perform him more. But he's for children, but we have that edge, that Muppet edge that goes along with him. When I've done movies like, with Splinter, for Ninja Turtles, I enjoyed that, because that was another different type of challenge that was more of a family-oriented type show. Doing a show like Dinosaurs with Baby Sinclair, that was for the family, but that was different from Sesame Street, and I enjoyed doing the character because that was different from Elmo or Splinter. So they all have a part in me that I just miss, the ones that I can't do, anymore, unfortunately. Those are the ones I miss, and I really enjoyed performing also. I think what I like about Elmo the most is because he's so universal that anywhere I go around the world, the kids know him. And so that's kind of fun, and that's enjoyable, to know that a character that I perform is so well known around the world.
He uses Elmo's popularity to speak to children around the world and wherever hope is needed.
It's nice that you don't have to sit and watch TV and see a tragedy happen and not know what to do. Just as soon as that happens, we're on the phone talking to PR, our PR department at Sesame, saying, what, we need to do something, what can we do, let's go. I mean, it was like with 9/11, just as soon as we heard that all those kids were relocated, the cast and the Muppeteers were there. The same thing with Katrina. They told us, we wanted to go right then and there when we saw, at the Dome and everything. When they said, well, right now it's a little too much chaos going on, let's see how it settles. And then we started going to the schools, and a lot of different schools around New Orleans and Texas and everywhere that was affected. And we got to, to help in certain ways, if you can help with it, as tragic as that was. And so it's really nice. It's really nice to be able to know that this character in Sesame Street is so popular that you actually can go out and give back as soon as possible.
In 2006, he wrote his autobiography, My Life as a Furry Red Monster.
Just the connection that I've had all over the world with letters that I've gotten from parents and people who don't have kids, how they connected with this character has been unbelievable, and that's what I wanted to talk about. Also talk about the love and the respect that my parents had for me, you know, that they're the ones who really encouraged it. That, you know, I've heard from other friends of mine who didn't have that support, because, you know, this is puppetry. You know, it was like, okay, you know, doctor, lawyer, okay, you know, put that down, put that doll down, and, you know, go to school. But my parents were so supportive of all of us doing whatever we made us happy. And my mom, I remember my mom saying, you know, you have a job where, you know, you have a job that you can make money and you really enjoy it. So that's the best thing in the world.
WIC, the Women, Infants, and Children program, serves low-income pregnant, breastfeeding, and non-breastfeeding postpartum women and their children up to age 5 who are at nutritional risk. Joining me to discuss the program and breastfeeding are Angie Wilkes-Tate, WIC Project Director, and Angel Harris, a WIC mom who is currently breastfeeding. Ladies, thank you for joining me.
Thank you. Thank you.
Angie, how does WIC help women during pregnancy?
WIC has the ability to provide additional food benefits. We also provide referral sources to places within the community, whether it's health, housing, etc., and also just providing breastfeeding promotion and support there for those moms who might desire to do that.
Who's eligible for WIC?
We have, as you said earlier, the women who are pregnant, women who are breastfeeding, and moms who had a baby within the past 6 months can participate in WIC, and also children from the ages of 0 months to 5 years of age.
Okay. Angel, why did you decide to breastfeed?
The reason why I chose to breastfeed was because my mom had breastfed myself and 2 brothers, and she always spoke to me about the benefits of it, the cost efficiency of it, and just the bond of it, and it just sounded so rewarding, and I knew from the get-go that I had to do it.
So as a WIC client, you go to the grocery store. Give us an idea of the items that you purchased. And
some of the new WIC foods that I can get are whole wheat bread, tortilla shells, brown rice, milk, eggs, cheese. For a breastfeeding mom, you get carrots and tuna, so it's a lot of good nutritious food.
What kind of food items are common amongst women when they are going through this nutritional journey?
Well, the most thing as far as what we encourage them to have are fresh fruits and vegetables, which is something that we're able to provide now, which is a wonderful change. Also the whole grain or high fiber items that will provide that benefit. Protein-based foods such as eggs or peanut butter or dry beans and peas. And also we do have whole grain cereals. We also have the WIC iron and vitamin C fortified cereals as well.
Now you've named some very nutritional items that, you know, we probably learn about when we're in grade school, you know, those basic food groups. But what are some common nutritional mistakes that pregnant women make that may not remember what they learned in grade school?
Well, I think sometimes we have a tendency when we think that we're pregnant, we eat for 2, and so we might snack a little more often, but on some of the things that are not as nutritious, such as those high-calorie things, your donuts, your honey buns, the candy bars. So those things are, even though they provide calories, they're not the nutritious calories. So we have to talk to moms about how they can have a improved nutritional intake during pregnancy.
Why is it so important to ensure that babies are healthy?
Because specifically for us within the African American community, we know that our babies within the community have a higher risk of dying in that first year of life. So our role is to help those mothers have a healthy birth, a healthy outcome by taking good care of themselves during their pregnancy and eating well.
Can healthier babies lessen the obesity epidemic in America?
I believe that they can, especially breastfeeding has been found to reduce the incidence of obesity. So children who are breastfed, they can regulate their intake versus a baby who is formula fed and they just will eat continuously if it's provided to them. So that is related to decreasing obesity.
How are these women, are there women, Angie, that shouldn't breastfeed?
Yeah, medically, there are women who may not be able to breastfeed, or for disease entities that they may have, such as HIV positive or AIDS. Also, those women who are using drugs, street drugs of that nature. Mothers who are breastfeeding who have certain medications will have to clear that with their doctors to make sure, but for the most part, there are very limited reasons why a mom should not be able to breastfeed.
Do you test the moms before they become part of the WIC program?
No, we do not. Okay. The healthcare providers are responsible for that.
Okay. How can expectant mothers get on WIC? We have about a minute or so left.
They can call 1-800-722-2295, and that will put them in touch with a WIC agency near them.
Angie and Angel, thank you both so much for joining us.
Thank you. Welcome. Thanks.
And that wraps up this edition of Black Nouveau.
Remember, in the coming week, do something to expand your world. Good night.
Good night.